Hello, everyone, and welcome to another episode of the Wise Decision Maker Show, where we help you make the wisest and most profitable decisions. My name is Dr. Gleb Tsipursky. I'm the CEO of Disaster Avoidance Experts, the future of work consultancy that sponsors the Wise Decision Maker Show. And today with me is Clayton Key, the VP of Business Development for MyClearStep, and Shelly Bar, the Chief Medical Officer of that same company. Clayton, can you tell us a little bit about what MyClearStep actually does?
Yeah, so MyClearStep is the first completely numberless scale that provides a blind weigh-in solution, first and foremost for eating disorder patients in recovery, and now working our way into the general population as a way to avoid weight stigma.
Excellent. And Shelly, can you tell me a little bit about the medical reasoning behind the Clear scale?
Yeah, so it's a HIPAA-approved scale, so it definitely be used in medical offices. I use it both in-person visits, so that clients that come don't get triggered by going on a scale, which is really hard for a lot of our patients. But I also use it a lot on Zoom or in any sort of telehealth medicine appointment where clients are remote, especially in places where there aren't a lot of providers who specialize in this disorder. And so it can be used both in person and on telehealth. So that makes it extremely useful and reliable.
So tell me a little bit more. So obviously we have much more remote work and remote telehealth, remote everything with the pandemic. What do the specifically remote telehealth benefits of MyClearStep involve from a medical perspective?
Yeah, it's actually been really amazing. And I think that, if anything positive can come out of COVID, this is one of them, teaching us how to do remote work. It's allowed us for reliability because we have a client going on a scale that we know can be reliable, can be safe. Numbers are directly provided to the clinician. We can tell based on how they get on the scale whether they're altering some of their numbers, which some of our clients do. But also with a blood pressure cuff, we can do a lot of medical monitoring, looking for any sort of medical complications of eating disorders. And if we take it one step further, we can ask them to get blood tests from their providers or from another lab. So it really allows us to do the entire medical monitoring by telehealth.
So it's interesting. I know from stuff I've read that, let's say, especially women during throughout the whole menstrual cycle and so on, they can vary by as much as 8 pounds. And you can correct me if I'm wrong, with their weight just because of water and their hormonal changes in their bodies. Help me understand how you address this with MyClearStep. Do you track their menstrual cycle? Like, how does that happen?
So as a medical provider, especially in this field, I always track menstrual cycle. It's a very big indicator of hormonal health and balance in the body. So that's almost done separately. But we do track weights on a regular basis. I wouldn't say it fluctuates by 8 pounds. That's quite a bit, but it definitely can fluctuate from fluid shifts. What's great, and probably Clayton can explain more about the mechanism of how it works on the back end, but I can see percent muscle and percent fat when the client goes on scale. And so when I see large shifts in those numbers, or if clients put things on the scale that shifts the numbers, then I can tell if there's big changes happening.
Okay, Clayton, can you follow up on that and help me understand specifically how the scale addresses the body composition? Because usually that's done with things like DEXA scan or other things that actually evaluate body composition, maybe the clippers, whatever those things are. I forget what the technical name is. So you tell me a little bit more about the body composition. That's quite interesting.
Yeah, so this is an area I have a pretty extensive background in. So, as you said, DEXA scanning, underwater weighing, calipers even tend to be quite common for assessing body composition. And those are pretty normal methods. The method we use, and it's used in many other brands, not just our own, is bioelectrical impedance. So there's just a small voltage of electricity running through the body, and the current is able to detect muscle versus fat. And so that information is still not available to the client, right? The client actually gets no feedback on either their weight or their body composition, but the clinicians that are reviewing the data are able to leverage all those metrics to make the best decision for their recovery.
Interesting. How well does the current methodology correlate with the calipers and the DEXA scan?
So they're all going to be varying levels of accuracy and precision by method. So the most important thing is just being precise so that it's monitoring the change and consistent from reading to reading. So whereas, you may do 3 to 4 different types of measurements, say you get on a DEXA scan, then calipers, then do bioelectrical impedance, they may provide you with all 3 different numbers, but the focus that we're really trying to, bring to light and utilize as a mechanism for providing treatment is the changes. So in weight restoration or whatever the plan may be, we want to see that the metric is moving one direction. So it's less about the accuracy of one specific reading versus just the precision of reading to reading. If it says that you increased 1% body fat, did you actually increase, or those sort of things? So we have a pretty highly reliable, precise reading, and haven't had any sort of issues on that front.
What have you seen with patients in terms of telehealth? Like, this is when we're talking about telehealth, the compliance with doctor recommendations when they can't directly see their weight and body composition changing, when they need to have that trust with doctors? Is it more difficult to build up that trust when you have telehealth? Is it not as difficult? Tell me, and how well do, as a result, patients comply with the directions of the doctors? So tell me a little bit more about that, Clayton, and then I'll turn to Shelly to give her perspective as a medical specialist.
Yeah, I would actually default to her first, I think, because, it's definitely her area of expertise. We provide the tools to help connect patients to doctors, but we don't provide any direct service as it would be on the telehealth side. So I would defer it to Shelly to kind of address how, what her experience has been.
Okay, Shelly, then the question to you.
Sure. I mean, I've had amazing compliance. I do have the clients all do it frontal with me. So even though, we're on a telehealth platform, I watch them do the measurements. So they get on the scale, me live, they do the blood pressure measurements with me live. Everything occurs in front of me. So in that respect, compliance is high. Think when maybe things are asked of patients to do outside of the appointment, it is more difficult to ensure, but that's why I make sure everything is done but in front of me. So that's really helped. I think most clients actually feel a lot of relief that they don't have to see the number constantly, especially as you mentioned changes. I mean, there's hormonal changes. There's whether someone's had a bowel movement, whether it's hot or out and they've been drinking, or, there's so many things that affect our daily weights. So not having that number constantly in front of them is actually quite a relief and allows them to be more natural in the meeting and more themselves. So that's really worked to our advantage.
And is that a protocol you recommend to other clinicians who use MyClearStep, or do they just use it however they want? Tell me a little bit more about that, Shelly.
Yeah. So, I mean, it depends where MyClearStep is used. If it's used in a doctor's office or a telehealth, I definitely recommend doing those measurements live and not relying on the clients to do it on their own. One, they don't always remember, right? If we're doing orthostatic vital signs, to lie down for 5 minutes and then stand. I mean, it's, things that are harder because they're so protocolized to do. When the scale is used in a residential, right, it's used differently. But then also clients are getting on live. So every area that it's being used can be used a little different. I still recommend in whatever respect it's being used to be done live.
Okay. And Clayton, switching gears a little bit to a different topic that I'm curious about. So I know that you're thinking about using AI for MyClearStep. Tell me a little bit more about what you're doing there and how it's improving the product.
Yeah, so as Shelly mentioned, a lot of what we deal with is an eating disorder population that can at times attempt to manipulate their data in one way, shape, or form. And so what we're trying to build out and determine is if we can create something that really notifies us sooner of any sort of irregular measurements that may need to be brought to the attention of the care team, whether that's a doctor, a dietitian, a therapist they're working with, or even simply a parent that's monitoring the data who may not be as well trained to identify some of these signs and symptoms. So that's first and foremost what we're really trying to do is get earlier and earlier with detection so that we can just address anything medically as needed.
And how often is it that, Clayton, that parents are actually the ones who are using this with their children versus the patient themselves, adult, using this for themselves?
Yeah, so I would say it's, probably about a 70-30 split where about, a third or so of our population would be children that are still being likely monitored with a doctor or some sort of clinical professional, but the parent simply being a secondary support system to have access to the data and help along the way monitor their child's recovery. So somewhere in that range, we actually have a pretty broad audience. We started in 2020 really hyper-focused on both virtual care and eating disorder, and became a market leader within both those segments, and then have transitioned since then into actually providing a blind weight solution in clinic. So as Shelly said, people can actually come into the office, step on the scale, visit with their clinician as needed. And now we're branching out beyond eating disorders into a number of different fields simply to try and help remove that weight stigma. So any sort of area where blind weight solutions could be helpful to prevent developing any sort of weight stigma, such as college athletics, pediatrics, cancer recovery, whatever it may be.
Excellent. Well, that's very helpful context. Thank you very much. I really appreciate you sharing about what you're doing. Any last words before we finish up the interview? Shelly, let's start with you.
I would say that I feel the MyClearStep has really revolutionized the care of eating disorders in both outpatient and inpatient care. And as Clayton mentioned, also getting into other offices like pediatric offices would be huge. As someone who did a lot of college health at Stanford, college health offices would also be really important. And I think it's about stepping out and letting people know about it so that people get the care they need.
Thank you. And Clayton?
Yeah, just reiterate everything Shelly said, and I can't, speak enough about the impact that a blind weight solution can actually have, regardless of the scenario, the age of the individual, where they're at on their health journey. I think it's pretty obvious diet culture has gripped our society and led to a lot of challenges facing people. And so if you're interested in MyClearStep, please out at MyClearStep.com.
Excellent. Well, thank you very much. And thank you to the audience for checking out another episode of the Wise Decision Maker Show. Please make sure to subscribe wherever you checked out the show and leave a review. It really helps us improve the show and it helps other people discover the show. All right, everyone. I look forward to seeing you in the next episode of the Wise Decision Maker Show. In the meantime, the wisest and most profitable decisions to you, my friends.